Okay, well, welcome everyone to our webinar today, presented by the Partnership for Food Safety Education, the Consumer Food Safety Education Toolbox and Guide. I'm Rouhani of the U.S. Food and Drug Administration will be presenting. There she is, Public Health Educator at USFDA, and I'll be moderating. My name is Mary Saucier-Choate, and I'm with the Partnership for Food Safety Education. I want to welcome you all who are coming today. It looks like we have quite a few hundred people, so this is very exciting for us. Just a few house notes. 1 hour of continuing education unit is available from CDR and from NEHA. If you are on our Backfighter e-list, getting our weekly e-cards, you'll receive the link to the CEU as well as the link to the PowerPoint and the recording in the weekly e-card. If you want your certificate right away, if you look at the sidebar, you can see downloads, and there's 2 certificates there, one for CDR and one for NEHA. You can download those right now. Or if you want a different way to get your CEUs, if you can just wait a couple hours before I get it online, you can go to fightback.org, click on the Events tab, select Recorded Webinars from the drop-down menu, and you'll be brought right to the links to the CEUs, the recording, and the PowerPoint. So, when we get done, we will have a question and answer session for all of your questions, and just write your question. You can do it now or do it when the question and answer session starts. Write your question right in the question box, and we will move through them from first to last. Well, first as to how many we get to. All right. After the webinar, you'll receive a brief evaluation, and we really encourage you to fill it out so we can make these presentations even better for you in the future. Our learning objectives today are you will be able to identify the strengths and weaknesses of your programming. You will learn to use evaluation data to continuously refine and improve your programs. And you'll gain insight to help you understand the impact of your programming, the audience you're serving, and the role you play to contribute to the program's success. So we're going to start out with a poll. And we want to know, is your organization evaluating programming now? So, wow, you guys are great. Answering right away. I'm watching all the numbers click up, and just give you a few more seconds to answer that. Okay, well, it looks like a few people are still answering. Okay, so I'm going to go ahead and show you those results. And it looks like 32% of you are evaluating your programming now, 51% are not, and 17% don't know. So perfect. This jives a lot with what we found, which I'll be talking about in a minute. Okay, so just a little bit about why evaluate. Evaluation is needed to understand what kind of effect your activities are having. You know, you measure it, you can manage it. Evaluation data can show you how successful your program is in preventing foodborne illness and promoting safe food handling practices. When you share what you learn from your evaluation with coworkers, other consumer food safety educators, you can help them design their own programs more effectively. The documentation and data you'll collect to evaluate your program can help obtain continued or new funding. A lot of grant, the process for applying for grants requires documentation and data. And finally, showing the target audience how effectively your program works can help you to increase interest and participation in your programming. So now I would like to launch the next poll. Which tools do you currently use in your evaluations? Check all that apply. So you can see there's pre and post surveys. To use those, tests and quizzes, Do you use surveillance? Do you actually go audit and visit? Or do you do something else? Give a few more seconds, folks, to register. Okay, I'm going to go ahead and show you the results. All right, so it looks like 46% of you who are evaluating your programs use pre and post surveys. 35% use tests and quizzes. 21% use surveillance. 40%, wow, use audits and visits. 19% do something else. Okay, well, really interesting group we have here. So let's move on a little bit more before we get to IMA's part. One thing we notice, evaluation is often missing. In a survey that the partnership did in 2014 of about 400 organizations involved in food safety outreach, we found that about 1/2 were not or did not know if they were evaluating their programs. So that's about what we have here today on the call. About 1/2 were not evaluating the programs, and actually more than that if you add those who didn't know. So that's why we have this tool. Those that did measure their impacts used what we just tested on: pre and post surveys, tests and quizzes, surveillance, audits and visits, and also WebNears, the web-based nutrition education evaluating and reporting system that's based at Cornell University. This is a secure password-protected system used for FNEP and SNAP-Ed data collection and reporting, so folks use that as well. So now on to the actual presentation. IMA's going to talk about the Toolbox guide, the Toolbox and guide components. She's going to highlight strategies, tips, and tools on evaluation. Okay, and this, if you've been online to see the Toolbox, it's the front page looks like this, and there's the web address right there, evaluationguide.fightback.org. And now, over to you, Ima. Oh, sorry, I lied. We're going to ask, that was what the evaluation guide looks like. And now one more poll before we get going. Have you visited the evaluation guide online? It is pretty information rich, so if you did, that was a good idea. If not, you're going to get a really good introduction today. Okay, so it looks like everyone's voted on there, and let's go ahead and share those results. So 71% of you haven't. Great. This is a perfect time to get a really good overview of the evaluation guide, and about 1/3 of you, 28%, have been. Fantastic. Okay. So now, on to Ima Rouhani's presentation. Thanks, Ima.
Thank you so much, Mary. All right, so I'm going to talk a little bit about the research that went into the guide and toolbox. So development of the guide was informed by a survey administered by the Partnership for Food Safety Education. And in the survey, the majority of a convenient sample of food safety educators, backfighters, so 63%, indicated that they would like more training on evaluation. In addition, after research, we found that online educational materials focused specifically on the evaluation of consumer food safety education is limited, making a resource such as this guide important to have available to consumer food safety educators. So findings from a comprehensive assessment of consumer food safety education strategies also informed the guide's content, and drafts of the guide were reviewed by 10 health educators who provided feedback during drafting stages to improve content and usability. Reviewers included health educators at the FDA, and 6 one-on-one interviews were also conducted with consumer food safety educators, backfighters. All right, next slide, please. So the guide is available in a web and PDF version. The web version is easier to navigate, but you will need to sign up and log in for some of the web content. So there's several chapters in this guide. We have the overview and importance of evaluation, formative program planning, mapping the intervention and evaluation, selecting an evaluation design, data collection, data analysis, and Chapter 7 of the guide, which is the Toolbox. Next slide. So the Toolbox contains customizable resources to help food safety educators with planning and implementing their evaluations. The guide includes, for example, a printable tip sheet for evaluating educational presentations, such as a workshop, a class, training, and also a tip sheet for sharing and evaluating educational information available online, such as an online brochure, an online fact sheet. And we hope that the tools in this toolbox will be especially helpful to food safety educators who need to evaluate their activities when time and resources are limited. So I'm going to move on for now, but we'll touch on some of the other tools in the toolbox in the following slides. So the Toolbox and Guide was launched and made available online on January 25th to coincide with the Consumer Food Safety Education Conference. Each conference participant received a flyer in their conference tote bag, and the resource was also introduced during an opening plenary session. We also facilitated a pre-con workshop on evaluation and the new resource. The workshop covered the key aspects of program evaluation, included interactive hands-on activities, and a Q&A session with 2 food safety evaluation experts. 18 food safety educators participated in the workshop, and reactions to the resource during the workshop was very positive. Next slide. So I want to talk a little bit about some of the content in the guide and how the information can help food safety educators with their planning and evaluation efforts. So one important thing to consider when planning and implementing an evaluation is the quality of the evaluation to ensure that evaluation efforts are ethical, feasible, and thorough. So the guide provides examples of different evaluation standards identified by the Joint Committee on Standards for Educational Evaluation for educators to think about. So examples include timely and appropriate communicating and reporting, concern for consequences and influence, human rights and respect, and clarity and fairness. And it's really important that educators think about these standards and plan their evaluation as they design and before they implement their program, so not after. If possible, food safety educators could consider forming an evaluation team of staff, partners, and stakeholders to ensure that the needs of various stakeholders are being met and that unique and diverse ideas and resources are brought to the table. The guide includes strategies for building a team, tips for selecting a team leader and forming partnerships, and a list of relevant stakeholders and potential partners. Now, in order for programs and evaluation efforts to be effective, a clearly defined target audience is also important. So the guide provides different examples and ways for educators to narrow down their target audience. For example, educators could narrow down the target audience by starting with a specific food safety behavior, or by narrowing in on a setting, such as a senior or community center. So the guide covers the steps needed to select a target audience, as well as examples of populations that food safety educators might want to choose as their target audience. So to identify what factors influence the identified target audience's food handling behaviors and what education strategies should be used in education programs, a needs assessment is key. Next slide. So the guide includes a list of specific factors and corresponding questions that could be included in a needs assessment in order to identify specific food safety barriers that influence behaviors. For example, food safety educators may want to find out whether or not there are any resource barriers, such as a lack of thermometers or storage containers, that prevent the target audience from adopting safe behaviors. Another factor to investigate might be related to cues to action. So food safety educators might want to find out in the needs assessment if there are any reminders or cues that the audience thinks would motivate them to engage in certain food handling practices, or if there are any cues to action the target audience has already found to be successful in the past. Can we go back one slide, please? So utilizing behavior theories can also be an important component of program planning and evaluation. The guide provides information on how educators can use theory to plan their program or inform a needs assessment, an evaluation, and even the development of educational messages. So the guide provides examples of how constructs from two theories, the trans-theoretical model and the theory of planned behavior, could be applied. The guide also includes strategies for developing and disseminating educational messages. It includes information about the different types of messages that could be developed, how appeals and incentives can be used, the importance of timing, such as making use of national health observances to coincide with outreach, and a list of existing materials on food safety that already exist and could be used so that health educators don't have to reinvent the wheel. The guide also includes tips for how to address health literacy and cultural sensitivity, and some helpful websites that can be used to create and refine content. Next slide. Need to go one more slide. All right, perfect. So at the end of each chapter is a set of summary questions to reinforce key points and help food safety educators apply what they learn to their own program activities. Next slide. As previously mentioned, the Toolbox includes customizable tools that people can download as a Word document or as a PDF to help them apply information in the guide. For example, to help with planning and evaluation budget, people can download this budget tracker form to customize and use. Next slide. To help food safety educators with planning, the guide also includes information on how to create a logic model. It provides an example of a logic model developed for a hypothetical food safety education program. Next slide. Educators can also access a logic model template in the Toolbox that they can fill out themselves and use. Next slide. So one of the strengths of the guide is that it includes many examples specific to food safety that can generate ideas and help food safety educators really understand how the different evaluation topics can be applied. For example, to further explain how to identify indicators for different evaluation outcomes, a table is included in the guide that includes outcome and indicator examples for different levels of evaluation, such as assessment of inputs, activities, or actions and behavior. So let's look at an example on the side. So if we were focusing on participation as the assessment level, examples of goals or target outcomes for this could be that you have a target quota for participation, and that might be 100 participants. Another goal might be that workshop members consist of your target audience, which might be parents in school district X. Another goal might be that participants stay for the entire duration of the workshop. So your indicator for these goals or outcomes could be that the participants fill out a sign-in and sign-out sheet, and that the sheet documents the time that the participant signs in and out, and whether or not the participant has a child that is a student in school district X. Next slide. Next slide, please.
Oh, sorry. There we go.
No worries. Okay, so if we're looking at another example, assessment level for actions or behaviors, a goal or outcome might be that participants apply skills that they learned to avoid cross-contamination. So your indicator could be the number of participants that reported application of new skills and separated raw, cooked, and ready-to-eat foods during food prep and storage to avoid cross-contamination. So the guide also provides explanations of the 7 assessment levels and what exactly they entail. Next slide. So another example of a helpful resource included in the Toolbox is the activity tracker form that food safety educators can download and customize to track their activities and conduct a process evaluation. Next slide.
Oops, sorry. There we go.
So when selecting an evaluation design, it is important to select a method that reduces the risk of internal validity threats, which is the extent to which you can ensure or demonstrate that external factors other than the independent variable or the program did not influence the outcome variables. So the guide describes different types of internal validity threats and includes food safety education specific examples of these threats. For instance, social desirability bias occurs when participants provide responses they believe will be pleasing to the interviewer and will make them seem more favorable. So this can lead to over-reporting of perceived positive behaviors and underreporting of perceived negative behaviors. So an example of this is if in one-on-one interviews, participants share that foodborne illness is of a great concern to them and that they always try their very best to practice safe food handling practices at home. But they do this because they want to impress the interviewer and think that is the correct answer, not because it's actually true. So to minimize threats to validity, food safety educators should consider using experimental designs with random assignment and a control group when possible. So the guide includes a table with descriptions, benefits, and limitations of different evaluation designs, in addition to which option might be more suitable given the resources that are available to the educator or the evaluator. Selecting a sample is also a key part of the evaluation process. So the guide explains the differences between probability and non-probability samples, examples of each, and important steps that can be taken to identify and narrow down the sample. The guide also includes information on how to determine the minimum sample size needed to detect change, another important factor to consider. Next slide. So this is a graphic pulled from the guide that shows the different steps in narrowing down and identifying a sample, and examples of each step for a hypothetical target audience. So for example, we have theoretical population, which is who you are generalizing your findings to. An example might be all mothers or food preparers. Next, to narrow down, you would think about your accessible population. So the members of the theoretical population you have access to. So this could be, for example, mothers with children attending school in District X. Next, you have your sampling frame, which is the list of the accessible population from which you will select your sample. And lastly, you have your sample, which is the individuals you choose to be in your study or the evaluation sample. So this might be 100 mothers randomly selected from schools A and B. Next slide.
Ooh, we have a poll question. So talking about sampling, we're going to ask you, what is the size of the group you are planning to evaluate? So let me launch that poll. Okay, if you wouldn't mind just letting us know what's the size of the group you're planning to evaluate. Okay, just give folks a few more seconds to tell us. Okay, let me. Okay, it looks like about a third of your groups are quite small, 1 to 10. Almost 60% of you will be evaluating groups of 10 to 100, and 14% over 100. So this is wonderful. And the cool thing about the evaluation toolbox is that it can help with all those. So I guess we'll move on. Thank you. Back to you, Ima.
Thanks, Mary. All right, thank you. So throughout the guide, educators can find how they did it boxes that show how other food safety educators have evaluated their programs. So these examples demonstrate how the evaluation information in the guide can be applied in real-life settings. Next slide.
Oh, sorry. There you go.
So the guide covers the benefits and limitations of different data collection methods and the type of data collected, such as quantitative and qualitative data. So oftentimes, food safety education evaluations rely on self-reported data, which can be tricky if trying to ensure that the data is valid and reliable. So when possible, using mixed methods can be helpful. So the guide provides examples of how other food safety interventions have utilized mixed methods to collect data and report their findings. There's also a list of valid food safety tools in the guide that food safety educators could use or adapt for their study. So this includes an audit tool for domestic kitchens, a consumer food behavior questionnaire, and food safety knowledge and attitude skills. So survey development strategies are also covered in the guide. For example, the guide talks about the importance of collecting demographic data, how to make sure that measures used are sensitive to change, how to pilot test a survey instrument, such as by utilizing cognitive interviewing techniques, and how to use learning objectives to develop survey questions. The IRB informed consent process is also important for food safety educators to plan for and think about. The guide includes specific tips for the informed consent process, such as viewing and treating participants as part of the decision-making process by assessing and confirming comprehension or by using the teach-back method or the teach-to-goal method. So this involves participants saying back to you the information you shared with them until they demonstrated that they fully understand the information. The resource also includes guidance on data analysis, such as steps for inputting data, clarifying your analysis approach, looking at descriptive data, change and association, and so steps are included for both qualitative and quantitative data. Reporting is also a key part of the evaluation and something food safety educators shouldn't forget about. The guide includes a list of reporting strategies, important questions to reflect on with staff, partners, and stakeholders following the evaluation, which I'll share on the next slide, and a list of publications that educators could submit their findings to, as well as different ways to present findings within their own community. Next slide. So the slide includes examples of different topics of questions that educators might want to ask and reflect on with staff and stakeholders once the evaluation data has been collected. So for example, you might want to ask, can any changes be made to better address the needs of the target audience and any barriers it is facing related to food safety? Do any education strategies and methods need to be modified for the program to be more effective in influencing food safety knowledge, attitudes, skills, aspirations, and behavior? Do program staff or volunteers require additional training or support in a particular area? Are there any additional resources we could use to maximize our impact? Does any additional evaluation or research need to be conducted to formulate better conclusions about the program? So it's important that consumer food safety educators put evaluation data to good use and identify actionable steps that can be taken to improve the program. So these types of questions can help food safety educators reflect on what parts of the program worked, what didn't, and what the next steps towards program improvement might be. Next slide. So if a rigorous evaluation with an experimental design is not possible, some evaluation is still better than doing nothing at all. Food safety educators can use resources in the toolbox again if they don't have time, money, or staff support for an extensive evaluation. So on the slide, you see a participant evaluation form that food safety educators can customize and use to evaluate educational presentations, such as a webinar or a training. Next slide. The educational material feedback form is another useful tool that food safety educators can use to gather usability data and feedback about their materials. Next slide. Templates are also available for educators who want to track and document web and social media metrics. Next slide. So before ending this presentation, I want to share some of the preliminary results we have received from the Partnership for Food Safety Education regarding usage of our resource. So as you can see on the slide, from the month of January through March 7th, we have had 2,425 users, almost 3,000 sessions, about 9,000 page views. The average page views per session has been about 3 minutes and 7 seconds. The average session duration has been 1 minute and 55 seconds. 81.1% of our users are new users and 18.9% are returning. We've also had 376 downloads of our guide and toolbox as a PDF. Next slide. So to promote the toolbox and guide, we have engaged in and will continue to engage in different forms of outreach, such as social media outreach, online newsletter posts, such as EdNet on foodsafety.gov, conference presentations, and working with agency partners. Next slide. So I'm not going to go through all of these references, but you will have access to these slides after the webinar, so you'll have the opportunity to go through them if you would like. Next slide. So thank you so much for your time. I really hope that you'll find the toolbox and guide to be a useful resource. I believe we have some time for questions towards the end of the webinar, but if any questions come up for you in the future, please feel free to email me.
Okay, that's great. Thank you so much, Ima. And now we have plenty of time, actually, for your questions. So I'm hoping you will look at the right there in the question box and ask us your questions. So one of the questions are the slides available? They will be available on the fightback.org website under recorded webinars. There'll be the CEU certificates and the PowerPoint slides, and this recording will be there. So I'm just wondering, I'm going to look for some more questions. Let's see. Okay. Well, thank you, Kelly. Is the toolbox specific to evaluation, or does it include intervention ideas also, Ima?
The toolbox is pretty specific to evaluation. The guide does include some information on program planning and program design, so that is included in the first few chapters of the guide. But the toolbox with the specific tools, which is chapter 7 of the guide, are really tools for evaluation.
Great. Okay, this one's from Matthew. Are there case studies to share how effective the tool has been?
Mm-hmm. Well, are you referring to specifically the toolbox and guide?
I believe so. Yes, yes, yep, yes.
Well, the launch has only been about a month and a half ago, so as of now we don't really have any case studies of people who have used the toolbox and guide, but since generally evaluation implementation is something that does take a while and can also take several months or even more than a year, we're hoping that down the road we do get some stories and case studies of people using the toolbox and guide and applying it for their programs.
Okay, define IRB, please.
So the IRB is the internal review board. So generally, if you're conducting any research or doing any studies that you wish to publish, going through IRB and getting IRB approval is usually necessary for that. And there's several requirements, such as getting informed consent from participants, and there's a section on that included in the guide.
That's great. What a comprehensive guide that is. Okay, another question. This is from Linda. What program are you using to track all the movement on the web pages? Oh, sorry, I should have read this quietly first. I believe our webmaster is using Google Analytics. I'm pretty sure that's what she's using. Okay, so another question. How does the evaluation tool use a follow-up for behavior change? Do you have a tool to go back in after the first outreach program?
So, well, some of the questionnaires and forms that we do have in the toolbox could be used in a pre and post. So that's definitely there for you if you would like to do in pre and post. But really, the tools in the toolbox are designed for if you are short in time and resources, so you need a quick questionnaire to provide participants following a training. But you could use, for example, the participant evaluation form or the educational material feedback form as a pre and post. You do have to tweak it and customize it a little bit, and that's why it's available in Word format for you to do that. But yeah, I think you can use that for a pre and post.
Okay, thank you. Oh, please repeat the online resource site name. I'm happy to repeat it. Also, it will be on the PowerPoint that's available on our website. So the website is evaluationguide.fightback.org. Okay. there's plenty of room for more questions, plenty of time in the webinar, so please go ahead and type in your questions in the questions box on the right of your screen. One thing that I think is great about the toolbox is its comprehensiveness, as well as that you can adapt it if you're doing outreach by social media to your whole community, thousands of people, or whether you're doing a group of 10 in your
Right.
local community. So that's really helpful.
Mm-hmm.
Oh, here's something. Do you provide, in the toolbox, does it provide advice on how to sell evaluation to higher ups? So this might be something about getting your team together. Do you have information on that?
Well, so we do have a section that talks about the importance of evaluation. So I would definitely share, you covered some of those, Mary. I would definitely share that with the higher ups, but nothing specifically to getting support from higher ups. But since there is a section on really the importance of evaluation and the benefits of an evaluation, I think that would be great to share to get some more support for evaluating programs.
That's true. All those at the beginning of the slideshow, that's right. The whys of evaluation are important. If they don't understand them, and their focus might be somewhere else, they might not realize how valuable it is. So you could use the whys to sell it.
Exactly.
Okay. Now, this is from Laura, how do we cite use of the toolbox materials, such as questionnaires, in publications? I know anything on the Fight Back website we request, everything's free, and we request that you mention it comes from the Partnership for Food Safety Education. What about citing the FDA? Have you talked to anyone about that, Ima?
I haven't, but since this is a co-branded resource, I think what you mentioned sounds fine, as just the mention of what was used and that the toolbox and guide was used sounds good. So yeah.
Right. So you could just say this was downloaded or used with permission of the Partnership for Food Safety Education and the FDA. That'd be fine.
Right. And I believe, I believe that the information that we put out as the government is for the public to use. So I would go to you, Mary, in terms of how you would specifically like people to cite.
Right. And that's just used with permission of the partnership. Okay.
Sounds
very good. Great questions. We still have plenty of time for more questions. We left a lot of time because we thought you would have lots of questions. We got a big thank you from Laura. You're welcome. This is
of course.
This is what our community does. The food safety community is very generous. And I know someone mentioned earlier about interventions, just have intervention ideas. You can get a ton of intervention ideas from the fightback.org website. If you click on our blog, we have story after story of different ways that backfighters like yourselves are out there in the community doing interesting things. And it depends on the community you're working with on how they'll work. But like, for example, one backfighter uses a sort of like a carnival wheel, like a wheel of fortune, but has a wheel of, misfortune around food safety. And so people pick one and they find out what's a way to get foodborne illness and how can you prevent it. So that's kind of fun. Other people, you'll read about the teaching about not washing chicken by using a rubber chicken in her bikini. There's so many clever things, using a toy refrigerator and teaching kids like how to, talking about refrigerating foods. There's lots of ideas on our website. Okay, lots of thank yous, but we would really like some more questions. We have all this time. So if you have a question about anything around evaluation that is in the toolkit, we would love to address it now. Again, if you think of it after the webinar is over, you can go to our website, go to the recorded webinars. You'll see the PowerPoint there and the recording, and there's Ima's contact information, as well as if somehow you don't remember that, you can always contact the Partnership for Food Safety Education, info@fightback.org, and we can help either answer the question or get you the professional who can answer it for you. Okay, Here's a question that I think we can answer. Do you have to have a ServSafe certificate or a HACCP certification? I'm assuming you mean, oh, to work with the toolbox. Oh, no, not at all. Would you agree, Ima? Even if you're not ServSafe
Yes.
certified or have HACCP, you can definitely still use the toolbox, and you will find it useful.
Mm-hmm.
Certainly, it's great if you can get your ServSafe certificate, but it's not required to use the toolbox successfully.
Right.
Okay.
And although the toolbox and guide is specific to food safety evaluation, food safety education evaluation, I think that a lot of the content can also be applicable to evaluating any type of health program.
Yes,
So
I
feel
was
free
thinking.
to share it with other health educators as well.
I was thinking the same thing, Ima. It can be
Yeah.
used for many, many kinds of outreach and education and for evaluation. Okay.
Definitely.
In general, what time intervals are recommended for program evaluation using the evaluation toolbox? So, if you go from beginning to end, it would take a while, right? If you started from the very beginning of the suggested steps to the very end, if you had that amount of time.
Right. I mean, evaluation, it's really specific to your program needs and the needs of your stakeholders and the participants you're working with, and maybe your sample size. So it really depends how much time, how long your evaluation could take. Yeah, I think with a lot of evaluation methods and what design you use and the time that you allot between your pre and post, it's really dependent on the program, your needs, your resources. But there are a lot of examples and suggestions included in the guide. Yeah.
So it depends on how.
Does that answer the question?
It looks like it depends on how. Well, he's saying 3 months, 6 months, a year, and so forth. And I know when I looked at the evaluation toolbox, I was thinking this could take a year from start to finish, but it doesn't have to. Like you said, if you're doing, if you don't have the resources to take a year, you may use the pre and post test, adapt it to your topic, and that's it. That would take, a week and not 3 months.
Exactly. Yeah.
Yeah. Okay, so Kelly says, I love logic models. Can you talk more about how you see that being used? Is this for internal use only? Want to talk about the logic model?
Right. So I think the logic model is really helpful in terms of planning your program initially, but it also helps with your evaluation, because when you identify exactly what you want your outcomes to be, your short, medium, and long-term outcomes, to identify the indicator for each of these outcomes, it really makes it clear for you what you need to evaluate and when. So if you fill out a logic model during your planning stages, I think it just helps a lot with evaluation as well. And there's an example in a section in the guide in Chapter 3 on creating a logic model.
Okay. Great questions. Let me just lost my place here on the questions. Here we go. Someone asked about, you need a registration number. This is for me, for the certificate. I'm assuming you're talking about the NEHA and the CDR, CEU certificates. If you're a member of the Academy of Nutrition and Dietetics, then you should download that certificate. And if you're a member of NEHA, you should download that certificate. And if you're not, then those certificates won't be really valuable to you. Okay, now Betty asks, did you measure the internal validity of the tools in the toolbox, Ima? Did you assess and measure the internal validity of the tools?
So we did not assess the internal validity of the tools, but some of the tools are adapted from previously used developed materials, so we didn't develop them from scratch by ourselves. But with a government agency, there's limitations to our evaluation capabilities sometimes. But there are a list of validated tools that are included in the guide that have been tested by other programs and other evaluation studies. and there's a list of those that you could use or adapt or apply for your own evaluations.
That's great. Another good question. What are some best practices to help eliminate bias or confounding factors? What are some best practices to help eliminate bias or confounding factors?
Right. So I think really the best thing for that is to do an experimental design and to have a control group. I think that's the best way really to reduce bias and validity threats. And also to test your tools and maybe do like a pilot test before using your evaluation tools, or a run through of program activities, things like that.
Okay. Someone asked if I could post the objective slide again. What I'd like to do is send you to the PowerPoint, which will be on the fightback.org website. Otherwise, I don't want to have this scrolling thing that I'll have to scroll through and make it look ugly. But I'm happy to either send you that slide, or you can just go to the website in a couple hours and it will be there for you. The PowerPoint will be there in this recording. Let's see. Looks like, we have such great questions. Okay. You do have to complete the NEHA form, which you can download right on the right of your screen there under the handouts, or you can get it, again, from the recorded webinars drop-down menu under events on the Fightback website. Let's see. Looks like you're in demand, Ima, to give a talk to some dietitians in New Jersey. So, Julietta, I'm going to ask you to contact Ima directly, and you can get, again, her information right from the PowerPoint that's going to be on the Fightback website. Okay. And
yeah, that sounds good.
Yeah. Wow. Such great questions. I'm going to give you a few more seconds to ask some more questions before we wrap it up. These were wonderful. And, you know, like Ima said, it doesn't have to end here. If, like I said, when we hang up, if you still have questions that you want to ask, Ima's available. Also, the partnership is available. Again, if we can't answer your question, we can route it to an expert who would be able to. This is great. You know, just like food safety educators, dietitians, every health professional, if you don't measure it, it's like you didn't do it. If you don't do the evaluation, I mean, we know we're doing great work, but if you don't document it and measure it with these kind of tools, you can't prove it to anybody. So this is a really helpful tool to just, again, to make our work better and stronger for the people we're serving, as well as to people looking at what we're doing, so they can understand that we're doing something that makes a difference. Okay, it looks like I'm not getting any more questions, so I guess this was fantastic. What a wonderful question and answer session. Thank you so much, Ima. I just want to
thank you everyone for your questions.
Yeah, I just want to wrap it up by making sure you mark your calendars for additional webinars that are coming up and knowledge exchanges, which are the teleconferences by phone. Tuesday, April 18th at 1, we're going to be revealing the Wing It campaign, which is a brown bag webinar focused on consumer safe poultry handling, and a wonderful program with lots of tools that educators can use to promote that food safety behavior. In May, Thursday, May 18th at 1, Hand Washing 2.0, again, that's the knowledge exchange. We're going to have Don Schaffner from Rutgers talk about the new WHO guidelines versus the CDC advice for consumer hand washing. So that should be really good. And there's more coming. I've been working on that all day today, actually. Lots of great webinars and teleconferences coming up this year. So I hope if you're not on our e-card list that you will sign up. You can do that right at fightback.org. So you'll get first dibs and first announcements when these things are out and scheduled. And again, we just want to thank our partners. We can offer these free webinars because of the sponsoring partners, and you can see them all here. And thank you. You know, without backfighters calling in and participating in these webinars and asking questions, nothing happens. So we really appreciate your attendance today. Thank you to IMA, and thank you to everyone who participated.